My Fertility Path, brought to you by the Fertility Awareness Advocate Initiative.
Fibroids are non-cancerous growth on the muscles of the uterus that usually appear during childbearing, yet in about 70% of women, especially black women. Fibroids are so common that it was said to cost the USA about $34 billion every year to treat them. Today on the show, we will be looking at uterine fibroids and how it can be a deterrent to fertility. The show is My Fertility Path, and it is brought to you by the Fertility Awareness Advocate Initiative. This is the only show where we talk about fertility, treatment options, and of course the joy that comes thereafter, if there is any. My name is Unsik Betim, and you're welcome to the show. It is important for couples to understand the connection between fibroid and fertility in order to get the treatment options necessary. We have here with us two powerful doctors. One is Dr. Lugbenga Shanu, a consultant gynecologist, and he is joined by our resident doctor, Dr. Abayomi Ajayi of the Nordica Fertility Center. You're welcome.
Thank you.
I'm tired of telling you welcome.
Oh, yeah.
But welcome, and thank you so much, doctor. And you, Dr. Shanu, you're welcome. Am I pronouncing your name right?
Very well. Very well.
Yay! That's good. Thank you so much for coming. Yeah. So I'll start with you.
Okay.
What is uterine fibroids?
Well, when you talk
or
of,
what are they, rather?
Yeah. Well, uterine fibroids are basically a non-cancerous growth found in the womb of the woman, actually as a result of excessive growth of the tissue of the womb. So when we have such, because it is not cancerous, they call it uterine fibroid.
So what causes?
Well, when you talk of causes of uterine fibroid, there's a lot of possibilities, but the exact cause of uterine fibroid is not known. But from previous evaluation, previous review, we could identify some possible factors that can increase the possibility of someone, a woman, having a uterine fibroid. And some of those possibilities, the commonest one that seems to be universally acceptable is race.
Race?
The race. You find out that in the blacks, compared to the white, we tend to have a high risk of having uterine fibroids. It's commoner in the black race compared to the white race. And the incidence is so huge, though several studies have quoted different percentages, ranging from 20 to 70%. But the consensus have said that when you put roughly about 10 black women in place, 4 out of 10 of them will have fibroids.
Would have fibroids.
Which is so huge.
That's very weird, considering the fact that I've also read somewhere that a deficiency of vitamin D could lead to it, but we have so much sun in Nigeria, so yeah. I'll leave that for another day. So what are the types of uterine fibroids, Dr. Ajayi?
Well, there are basically 3 types, depending on what part of the uterus they grow. There is the one that is in the wall of the uterus, which is called intramural, inside the muscle, intramural. There's the one that is called subserous, it's outside of the uterus, and it's just sitting on top of it. So that's called subserous. And then the one that, the worst variety is the submucous, which stays right inside where the baby is supposed to be. And that is the most troublesome of fibroids.
Of fibroids, okay. What are the likely symptoms a woman who's suffering from fibroids would see?
When women have fibroid,
yes,
in many cases it could be what we call asymptomatic. Like it will just pick, maybe I'll just do a routine check, they pick fibroid. But there are commonest symptoms that could come with could be, you just notice a bulge in your tummy.
The lower abdomen.
The lower part. And if care is not taken, if you didn't take necessary action, you could keep on growing. So your normal flat tummy now becomes continuously big. Then apart from that, so the next thing you start feeling that you could have occasionally pain in the lower abdomen. Or at times, based on the location, as MD rightly said, especially the one inside the cavity, the submucous. When you see your menses, maybe normally you maybe 3 parts before, that's that the menses is so heavy, and now you see maybe 6 parts, clots. Each time you see your menses, you feel dizzy, you can't really. So all those
anemia sets in.
Anemia sets in. You require blood transfusion. When so certain that it's important you see someone who actually has good knowledge about what to do. Then because of the mass, I said that the bulge in the tummy, because there are other organs in our tummy. So this bulge it has some weight.
Yes.
So it could impress on other organs in the tummy. Like it could, if it impinge on my bladder, I start what we call frequency of urination, I start going to, before I know I'm feeling pain, I want to pee. So apart from the pressure symptoms, as I've said, it could impress on the bladder, the bowel. Another very important thing that I would say with fibroid is infertility. So there's a relation between fibroid too and infertility. And one thing that make it so interesting is because nowadays most of our women, they delay achieving conception till 4th decade of life, when the risk of fibroid is common now. So it makes it necessary to actually explore this fibroid more, because it brings the fertility along with it, which makes it necessary to actually exhaust it very well and know what needed to be done. So if you need to address to improving the chances of fertility.
No pressure to us women.
At all.
So how is this diagnosed?
Well, just like Dr. Shanu said, majority of them are diagnosed accidentally. But so either by examination and then you confirm by ultrasound. In those days, we used to say fibroids feel fibroids. So we touch a fibroid, you know that is a fibroid as a gynecologist, but of course, you still need to do some tests now to do some, because again, there might also be some effects of the fibroids that you need to pick up. It depends, do some huge ones, you might even need to start checking for the kidneys that they're not affected because of the backflow, just like Dr. Shanu said, of impinging on organs that are near to it. But majority of the fibroids are diagnosed by scan.
Okay, can you, let's just double back a bit, because he mentioned that fibroids are also a major cause of infertility. So can you show us that cord that joins these two things together?
Well, I won't say cause, but they are associated.
Associated.
Yeah.
Okay.
Because for fibroids to cause infertility alone, they need to be in some places. Either they are occupying where the baby is supposed to be, which sometimes also will give you miscarriages, they will continue
recurrent miscarriages.
Yes. But for fibroids alone to cause infertility, it has to be blocking the tubes. So, and that doesn't happen all the time. But there is a lot of association between fibroids and infertility, because we've also seen in this environment that many people who have fibroids also have additions. Okay, that's like scar tissue.
Yes.
And we don't know why that is so, but there is usually, and it's associated with a lot of
Okay, you've mentioned scar tissue, which is, so are you saying that a woman who's had fibroids is more susceptible to having like stomach adhesions?
There was a study that a few years ago that showed that in Nigerians, that when you have fibroids, there is a tendency for adhesions to also be present. And so usually this might just be the cause of infertility. If the fibroid is not the one occupying or blocking
the adhesions come.
Yeah.
And it's not as a cause of it not healing properly, it just happens. Or bad surgery.
No. Even without surgery.
Oh, wow. That's interesting to know. You did mention non-invasive here just now, but I need to understand what other methods or how many other methods have we got in eliminating fibroids from the uterus?
When you talk of managing fibroid,
yes,
we've pointed out something clearly. Not all fibroids require attention. That should be clear. So that not all fibroids require attention, but you should ensure you see a preferably fertility specialist if you feel to advise you which one require attention and which one does not require attention. Okay. After stating that, for those that require attention, now there are options we could take. And if I'm going to break down medical, I say it could be medical, it could be surgical. The one that require no attention, we say conservative, like just they are sure. But the one that require attention, it could be medical, it could be surgical. Now, the surgical too could be divided into, it could be doing a major open surgery or doing a less invasive or non-invasive surgery.
Is that a laparoscopy?
Thank you. So when you talk of less invasive surgery now, the option laparoscopy comes in. Okay. And it comes with a baggage a lot of benefits if I'm doing not laparoscopy surgery. Okay. Unlike when I'm doing an open surgery. We jokingly mentioned the medicals that we call from Cape to Cairo. It's not that long anyway, but we make it wide.
Yes, the wide underneath here. Yeah, if it is just the bikini line.
Well, not big. Now we are trying to make it bikini line. Some even midline. But one pity of
midline this way.
Yes, that was the way it used to be.
Yeah. Oh,
that's what it means by Cape Coast to Cairo.
Cape Coast to Cairo. But then the bikini line is a more fashionable.
Yeah.
Okay.
So, but the beauty of laparoscopy, as we were saying, Just call it just pinhole surgery.
Pinhole.
Just small incision. So I can still go to beach, flaunt my tummy after doing my fibroid surgery.
I can.
So sure. And apart from that too, unlike in open surgery, when we do open surgery, we cut open. There are a lot of tissue handling when we are doing open surgeries.
Yes.
And there are a lot of exposure to atmospheric air. This is like doing a closed procedure when we do laparoscopic surgery. So there's no tissue handling. We are not touching the tissue. It's a closed surgery. We are not exposing the
organs,
atmospheric air. So risk of addition is very, very minimal. Risk of infection is very, very minimal. Risk of bleeding is very, very minimal. So doing laparoscopy brings a lot of benefit and even improve one chance of having conception.
Thank you so much. There's still more to come on the subject of uterine fibroids. When we get back, we will look at treatment options and what to avoid as a woman. Please stay with us. You're welcome back to the show. You're still watching My Fertility Path. We still have with us Dr. Shanu, a consultant gynecologist, and he's joined by our very resident doctor, Dr. Ajayi, the CEO of Nordic Fertility Center. But before then, what do you know about uterine fibroids and how it affects fertility? Let's find out.
Uterine fibroid grows in the uterus, and sometimes it can be very, very risky, especially for a young mother, especially for young people who are still in their reproductive age. It's quite challenging for them. So my advice is, if you identify that, that is growing inside of you, you should see a gynecologist.
Uterine fibroids are growth in the tummy that affects growth of baby or affects the lady's reproductive system or organ.
They are growths that are abnormal, but they are not cancer. They're not the bad cancers that can spread. So they are. It's the tissue of the womb. It grows abnormally in a way it shouldn't. So it creates fibroids, which are just like big polyps that could be inside the womb or outside or in the wall of the womb. And basically what that does is it gives different symptoms. For certain women, it makes them have very heavy periods and period pains. For other women, it can actually interfere with fertility.
I don't know a lot about it, but I know that my mom did have that, and she actually had to have it taken out. She had to have surgery for it. So I know it's really tough, and it does cause difficulties for women in having children. So I know that you do have to get it taken out, and it's something that you have to consider if you want to have children in the future.
I think every black woman has fibroids. I had fibroids. I still have some now. So I have a little boy who's 4, and it was one of the things that was monitored very closely when I got pregnant. So I had surgery in the past, not to remove the fibroids, but during another surgery, some fibroids, the larger ones, were taken out. And I think I still had about 3 little ones that were left in. So throughout my pregnancy, it was monitored. It wasn't found to be causing any distress to my son. So yes, I literally was monitored a little closer than I would have been if I didn't have fibroids, but I had my son and it was fine.
I had a feeling that a lot of people knew about uterine fibroids because it's pretty common, but I didn't think that no different types. But that's why we're here.
Yep.
So we'll talk about the treatment options, but just before we left the other segment, you did say something about minimal
Invasive.
Minimal invasive?
And non-invasive.
And non-invasive. What is non-invasive? Quickly, please.
That's one beauty of science.
Yes.
Because as science advances, there's a lot of new discovery to what to do. And there's this new way, I'm not sure it's done anywhere in Nigeria anyway, but we call it non-invasive, meaning an N-O-N, no incision whatsoever. And just call it by through high-intensity focused ultrasound, in which you just direct, not the routine scan we do in our consulting room nowadays, it direct high-intensity focused ultrasound to a certain targeted fibroid, and through that, it kills that fibroid cells, and gradually the size diminishes.
Ultrasound, okay.
But it's focused.
Okay.
You remember, I mean, as kids, we all played with magnifying glass and put paper.
Doctor, please. You said as kids, you and who? Concave and convex lenses.
Exactly.
Is that what you're talking
about?
Yeah,
that you put paper down.
And then towards the sun?
Yeah.
And
then
directly?
it catches fire.
Yes.
Yeah,
but we didn't do it together.
No.
I did it alone. So what are the treatment options?
Well, that's what he just said. That's the latest kid on the block. But some other minimally invasive, just for the sake of completion for our viewers. There's something we also call uterine artery embolization. Okay, which it's a minimally invasive method as well, which is done by radiologists, interventional radiologists, where you put some pellets into the uterine artery and it sort of tends to block the blood supply to the
so
uterus.
It dries it out?
It dries it out.
That's in layman's terms.
That's right.
Okay. So is there a certain lifestyle choice that can lead to one having uterine fibroids or helping one avoid them?
Seriously, none. Because it's more of a genetic thing. The only problem is that we've not been able to identify the particular gene now. That's why it runs in families. So there is really nothing that you can do to help you to have fibroids or not to have fibroids. Some people say smoking, maybe that is the only advantage of smoking, that you might prevent.
Minimize it and minimize the bleeding.
But I'm not going to recommend
I know
that.
you're not going
I'm
to
not going to recommend that to anybody.
A doctor has said that to me in Atlanta before, actually. Yes, they did mention that. With fibroids, is it true? I mean, these are just myths I've heard as a woman, because, you know, when you're faced with the fact that you've been diagnosed, that you have, we've seen, you know, some nodules, as they call them, I think. You know, they found some and then, you know, they said, oh, this is this diameter, this is that, this doesn't bother you. And then people say to you, oh, do not eat red meat. Do not eat, you know, certain foods, because they say you are feeding the fibroids. Is this true in any sense, or is it just a myth?
I say because it's a common thing in women. So there are lots of things people have said around. Some people say some certain that when they eat yam, it might increase the risk of this. But I'll tell you, just as my hem directly started, that there's no consensus, there's no uniformity. So anything that is not recurrent in every scenario, we can't really take hold of it. So I'll call it more of a myth than a reality.
Than a reality.
Yeah.
So would you say, and this is me asking, if you take too much, is it iron, that it can calcify? Does that make any sense? I just want to, because there are people out there who probably have read this as well. So I need to know, does it affect anyone in, excessive iron?
I would say no. But the same previous response will also explain this. Because it is so common. So the likelihood of people making a lot of suggestions still start coming in. It's one of those myths that comes with it. When we talk about even classification, what we often give such will be more of calcium, not iron. So taking that, I just clarify some of the myths that come with
because I know of calcium, but hearing of iron, I was wondering.
But I'm not saying calcium will make it.
No, I'm not. But we're saying that it can calcify if you take too much. Sure. I mean, and everything in excess. One other question, and this I know that my viewers would be wondering: can fibroids make a woman avoid sex?
I'm happy we are talking about sex now.
Yes, we all like to talk about it in the bedroom.
As a gynecologist, I don't mind talking about it in the open.
Thank you so much. That's why I have you here.
So when you talk of fibroid location,
yes,
my MD proudly mentioned the locations. It could be in the muzzle, it could be inside the cavity, and it could be on the surface.
Yes.
So in some cases, it could be in the cervical region. Some of those could be so long with pedicles that it's on the posterior wall of the vagina. Ooh. So for such, it could actually make sex so painful. So the location could determine if it's so that long or the posterior wall of the vagina. So especially when you have a deep penetration, of course, it makes it so you just won't want to have sex. And even some even use that to explain why infertility could be commoner in them. Because they tend not to even have enough sex.
They can't have enough sex, and then penetration is painful. Yeah. Oh, I'm not trying to imagine that. So in that case, would you advise surgery?
Thank you. Whenever there are symptoms,
yes,
it's important to intervene.
Okay.
The option intervention will not determine it is surgery, will not determine, but if there are symptoms, that it will be necessary to talk of intervention, which varies.
Thank you, Dr. Shan. When we return, we will take some questions from social media, so please keep them coming and stay with us. You are still watching My Fertility Path. Our guests are still here with us, and we have been talking about uterine fibroids, especially as it concerns fertility. Let's check some questions on social media, Doctor, and I hope you'd answer them for us. So I've got a first question, and it says, if you remove fibroids, can the effect of fertility be restored? Positively, I'm hoping.
Yeah, restored.
Yes.
Yeah. Yes. It actually is a very difficult question.
I'm sorry.
Because that's one of the things that blood supply sometimes is involved. But you could, to an extent, make the chances of pregnancy to be better. For example, one of the things that probably we've not said about the size of the fibroids, okay, the location and the size. Okay, if any fibroid where the baby is supposed to be should be removed.
Yes.
Any. But the ones in the muzzle and the ones outside the uterus, they have to earn removal. But just like Dr. Shannon said, they have to be symptomatic. Okay, so 5 cm, 6 cm is what we usually talk about about diameter. So, but when the fibroid is where the baby should be and you remove it, you increase the chance of success. But I'm not too sure whether it's to 100% because there'll still be some scarring. So that's why we always say that when you want to remove the fibroids, that is where the baby should be, it should only be through hysteroscopy. Because if you have to cut from outside the normal surgery that people do, then that means you have to cut through all the layers of the uterus, and that will give you more chances of having scar tissue. I hope I've spoken English.
You have spoken to me and spoken to this person. So how long can you wait after fibroid surgery before you attempt to get pregnant?
Well, after fibroid surgery, we always advise you can wait for 3 months. So some will say 3 to 6 months. So it also depends on how intensive the surgery is.
Because you need healing time before intercourse.
So within 3 to 6 months, I would say.
3 to 6 months. So someone says here, can fibroids grow back?
Obvious answer is yes, okay? But sometimes what we call that the fibroid has grown back is not actually because the fibroid has grown back. It's because some other nodules, seedlings that we could not remove during the surgery have now grown. But also it's possible for the one that you have removed to grow back.
Okay, we've got a fourth question. It says, if you get pregnant with fibroids, does it affect or have any effect on my pregnancy?
Having fibroid and pregnancies, the symptom is a function of where is the location of those fibroids. So one thing about is that as the pregnancy advances in age, the blood flow favors the baby than the fibroid. So it deprives it of blood supply, so it shrinks a bit. Doing that, it causes pain. So if it's a correct degeneration in pregnancies, it causes pain. And when that pain, it depends on how severe that pain is, it could increase the risk of having threatened abortion, as in the pregnancy being threatened. With other fibroid, one could have threatened abortion. But with fibroid, the risk increases. It could also increase the risk of having miscarriages. But with or without fibroid, people can miscarry. But with fibroid, it increases that risk of miscarriages. And also, to depends on how big they are, it could affect the lie the baby puts position to. We call it abnormal lie. Instead of baby lie head down, so it might prevent it. So it could also cause that.
Lie like that.
Yeah, and at delivery too, it could also pose a threat based on how many the fibroids are.
All right. So what size would cause this kind of problem? What size? I'm just adding to that question.
Well, it's difficult to say because what you think is a small fibroid, I mean, you just said it depends on the location. Depends on the size. But what we try to do, rule of the thumb, is that we remove the ones that we think can be troublesome before you get pregnant.
Okay, so...
But we've seen big fibroids that they don't even give you any trouble at all in pregnancy. So,
Okay. How often does being pregnant and yet having a fibroid lead to a miscarriage? I think you've broached on that topic, but can you help me? Because someone else wants to know. This is someone's question.
Like I said, it could cause pain in pregnancy. The womb is meant to be quiet things till the pregnancy is almost ready to deliver, before you now start having this contraction for labor to set in.
Yes.
But when I have pain in my womb, it could irritate it. I could be having an earlier contraction, and that could lead to possible miscarriages. So pain in pregnancy, which will be a result from the fibroid, cool. But it's not as if it's not a common thing. Just as Dr. Ajayi said, it's not as if it's a common thing. There are people with bigger fibroid diagnosis that might not have any symptoms. But in most cases, it could be managed. But when we evaluate it before pregnancy, the one that we think could impact on the successful pregnancy, we advise you to address to such, so that it can have a relatively seamless pregnancy.
So generally, you would say that it is advisable to take it out if you can?
I would say that you should personalize treatment for fibroids.
Tailored?
Yeah.
As the case requires?
That's right. That's what Dr. Shanu said, that there should be an assessment of the fibroids. It's not every fibroid that needs to be removed.
Because not every fibroid is symptomatic.
Exactly.
Thank you so much, Dr. Shanu, Dr. Abayomi Ajayi. Thank you very much, and your constant dedication in helping families to achieve what they want. My Fertility Path brings you all you need to know in your journey to fertility. Today, we spoke about uterine fibroids, what to look out for, and how it impacts on fertility. Thank you all for watching. Remember, infertility should never define you. See or speak to someone today. My name is Antique Breton. Keep sharing, keep educating, and I can't wait to see you next time.
My Fertility Path, brought to you by the Fertility Awareness Advocates Initiative.